SUI clinical coordinator here at SUI. I work with the students and the clinical sites to make sure things are running smoothly and students are getting the education that they need.
Through the years, talking with clinical sites, we did a lot of research ahead of time, and we asked clinical sites what would they prefer, a student that comes a few days a week and does their didactic learning at the same time, or for a student to come straight directly there and to be like an on-site employee or an on-site helper employee to learn. They all unanimously decided that they really like the idea of having full access to the student with no interruption to their learning. So the students go out with all the knowledge, they're ready to go. Now they put the didactic portion or their learning into practical use, and they see how it all translates together.
What makes SUI different compared to other schools? Students over here get the foundation down before they go into the clinical setting.
As a whole spectrum, we're looking at the student as a student, but also as a person. What are their experiences? What can they bring to the table? Are they truly ready for an allied health career? And are they ready for a rigorous program that we are going to provide here at SUI?
Spent the last year really investing in partnering with hospitals, learning what they need. What are you expected to do at a job? And that's what we're preparing you to do here. We're bringing in a lot of the techs that currently work at the hospital. The supervisors and the people that will be in charge of hiring are the ones teaching you in the labs here at SUI.
They are better prepared. They already know what they're looking at. There's no guesswork. They're not confused, not knowing what a different type of scan is. They already have the background towards it. Sure, they're always nervous, that's always part of it, something new and more challenging, but they now can focus on, instead of worrying about, okay, how does this physics principle work? So I have to learn how to scan here, and this is what it's going to look like in the final image.
We support them from day one on the administrative side of things, and we see that support continue on through the academic side of things, all the way up into when they start their clinical rotations.
Seeing students go from nervous first day at the clinic, and then they just transform into the techs that they become, and we get to be a part of that.
We are very, very hands-on with technology. So any new tech coming in, we are early adopters.
I love the fact that MRI has surpassed the need for surgery in some cases. It is a way of looking inside the body in a non-invasive environment. There is no destructive radiation. There is nothing to harm the patient.
Making sure that they are ready physically, emotionally, mentally, financially. When we deem that they are ready, we find that all of the front loading that we have done really helps them with their success in the program.
The fact that if you want to work in research, you can go into a hospital that does it. If you want to work at a clinic because you don't want to work at a hospital, you have the freedom. So many aspects to this field that just never limits you. And I love the fact that I can do multiple things without having to skip a beat.